A number of vaccines are now in phase 3 clinical trials, and we all hope to have a number of effective vaccines that can help prevent people from infection. However, there is no silver bullet at the moment, and there might never be. For now, stopping outbreaks comes down to the basics of public health and disease control: testing, isolating and treating patients, and tracing and quarantining their contacts.
So the first person we have is Ankit Kumar.
WHO recommends that mothers with suspected or confirmed COVID-19 should be encouraged, the same as all other mothers, to initiate or continue to breastfeed. Mothers should be counseled that the many benefits of breastfeeding for newborn babies and children substantially outweigh the potential risks for COVID-19 infection.
Brian, the next question goes to Simone McCarthy from the South China Morning.
The WHO advanced team that traveled to China has now concluded their mission to lay the groundwork for further joint efforts to identify the virus origins. As a result of these efforts, WHO and Chinese experts have drafted the terms of reference for the studies and program of work for an international team led by WHO.
Question is from Jamil Chaid, the Geneva correspondent for a range of Brazil.
Yeah, the team is actually not back yet, and we obviously haven't had a chance to debrief them. The terms of reference document that has been agreed with the Chinese colleagues lays out both the previous work that has been done to understand the disease and also the studies that are going to be needed to further understand the original cases in Wuhan.
Very full and comprehensive answers. We now have Anne Gulland back from the...
It would seem to me that in most countries that have experienced intense community transmission, the way out is long, and it requires a sustained commitment to doing many what on the face of it are very simple things, but are difficult to actually implement.
Recently, of their first several deaths.
Again, the potential for this disease to spread quickly in overcrowded urban areas and in poorly served rural areas is always there, and India will obviously have to keep up a very strong and sustained effort to both prevent the spread of the disease and to treat those who fall ill.
Question goes to Anne Gulland from the Telegraph.
It's not our job to tell the US what it should be doing at subnational level. The state-based planning and implementation guided by the national scientists seems to be the right path. The difficulty for us all is sometimes we know the right path. The difficulty is choosing to walk it.
On the remarks made at the weekend by White House experts about...
What we understand from many of these studies, these are estimates of the IFR, the infection fatality ratio, is that the estimates hover around less than 1% of 0.6%. And there are a couple of studies that are out that have estimated this 0.6%. That may not sound like a lot. But it is quite high. If you think about a virus that can transmit readily, that can transmit well.
Hola, buenos días.
If we have results back in 4 or 5 days, even longer, that is not going to help us. So the fact that we have rapid tests that are in development, and we should say it is really, again, incredible the amount of tests that are being developed, and the fact that we have rapid tests that are being developed, this is a positive thing, and this will help control efforts.